Hello, this is Anthony Kopp from Mercy One Physical Medicine and Rehabilitation. I'm one of the physiatrists here at Mercy One. We get a lot of questions about what is the purpose of physical therapy, what's the benefit of that. Today we're going to talk a little bit about that. First off, I want to go over some different types of therapies and as to why we would use them. First, we're going to go over physical therapy. What the heck is physical therapy? So physical therapy, when you go there, you're going to work with a physical therapist. Physical therapists now have to have a doctorate degree in order to be practicing. That means that they've done at least 3 years of course and clinical work in order to learn how to optimally treat their patients for musculoskeletal and neurologic issues. So the big thing that physical therapy focuses on is mobility and strength. They also, work on endurance and how that plays into your function. So depending on what you have going on, we may be recommending that you use physical therapy. Usually we start out a couple sessions. Initially, the therapist will help do some physical exams to help further diagnose what you have going on. And then they will transition more into a treatment for those issues. There can be land-based therapy as well as aquatic or water-based therapy, depending on what you have going on. Sometimes some conditions benefit more from one of those versus another. You can think of the therapy as almost like you're starting a new sport. If you've ever started a new sport, it takes a while. You need a coach in order to help teach you how to do certain movements, make sure that you're doing those correctly. And it takes more than 1 or 2 sessions in order to do that. The therapists are extremely good at teaching you how to activate certain muscles, how to stretch certain muscles, and they spend all this time so that they can learn different ways to troubleshoot and to help you optimize your time both in therapy as well as home exercise program. Next, we'll talk about occupational therapy. Occupational therapy, their therapists have to have either a master's or a doctorate degree in order to practice, so anywhere from 1 to 3 years after bachelor's of additional coursework and clinicals. The occupational therapists work on a lot of activities of daily living, or ADLs, things like walking, feeding yourself, dressing, toileting, bathing, transferring. A lot of those depend on upper extremities. So there's times where physical therapy will focus a little bit more on upper extremity issues. However, it's not necessarily, some people say PT is all lower extremity, OT is all upper extremity. That's not exactly the case. There is some crossover. So occupational therapists, again, will be teaching you how to, strengthen certain muscles that aren't working correctly, stretching out. They'll also help, give education on ergonomics, how to be more functional, and also to make functional gains. The next one we're going to talk about is speech and language pathologist. Speech and language pathologists, or some people say speech therapists, depending on the provider, they may prefer one way or the other. This is also a master's or doctorate in speech and language pathology, usually another additional 1 to 3 years of clinical and coursework after their bachelor's, learning how to help optimize function in people with impairments for communication as well as swallowing. The therapists do, the speech and language pathologists do a fantastic job of helping patients depending on what the issue is. For example, sometimes people have aphasia or difficulty speaking. The therapist will help the patient learn different ways or different pathways within the brain to get to the same point. Going back to the sports analogy, all of these are sort of different coaches, and depending on what your deficits are, they can coach you in different areas, and they're good at what they do. There is significant data for all of these specialties to help improve function in the patients. A couple other things to touch on. A good therapy program or an effective physical therapy program, as I mentioned, or occupational therapy or speech and language pathology program, they incorporate, a good exam, and then they're going to be teaching you exercises, but you're also going to be transitioning to those home exercise program. Just like if you're trying to get really good at something, you doing it a couple times a week, or only a couple times, that's not going to help you get much better, help you improve. You have to put in the time at home in order to make those gains in strength, makes those gains in range of motion, and also help improve, muscle firing pattern, which for many patients has been present for a very long time. There's some data that shows, you see a lot of people with back pain, that people with back pain, unless they have people teaching them how to activate certain muscles, those muscles never start to contract the right time, even if their pain is improved, which sets them up for this cycle of, low back pain of coming and going, or even chronic low back pain. One thing we also see in our patient population is maybe they'll do really well in physical therapy or occupational therapy or speech and language pathology. Like they'll have good improvements while they're in that therapy, but they say, as soon as I stopped it, those the effects of that all went away, and I just want to let that sink in, because if you're taking a medication for another medical issue, or if you are working out and you only take one sip of water at the very beginning, but you continue to work hard, you're continuing to sweat, you're going to need more water. You're going to need, depending on what your medication or your ailment is, you're going to need to take that medication consistently. You can't just expect that you do it for 2 days and that will fix you forever. A lot of these issues, it requires ongoing effort on the patient's part, and unless we see that effort continue, the effects of that will diminish. So I encourage people to plan on doing some of these things their whole life. Now, you may get to a point where the exercises that you're doing help out your situation significantly, and then you only need to maybe instead of doing those 5 days a week, maybe you do it 3 days, maybe you do it 2 days, or maybe you do it once every couple weeks, just to make sure that you're not falling back into those poor habits that you had before. Get the tight muscles, the weak muscles that led us to have the symptoms that we're having in the first place. Now, I don't always get it right. Sometimes my diagnosis, I think that one area is causing the issue, and sometimes that area improves, and then something else comes to the forefront. So there may need to be tweaks to the therapy plan as we go. I encourage the patients to pay attention to what they're feeling during the time that they're in therapy. How is your pain changing? How has it improved? What's different about it? And making sure that you're giving your feedback to the therapist so that they can help, coordinate care with their physician as well to try and optimize that time in therapy. We do not want to waste your time and money. Last thing to leave you with is our bodies respond to our bodies adapt to what we ask it to do. So if if we are sitting for most of the day, we're not doing anything but getting up to, go to the bathroom, get something to eat, or to see who's at the door. If we're sitting for most of the day and we're not moving much, that is what our body will adapt to. So when we want to go on vacation or go visit our friend or go to the grocery store and have to walk, further than we're used to doing, our body will start belly aching. It's going to start hurting. It's going to start having more symptoms. So it is our responsibility. We get one body in this life, so it is important for us to use that body to the best of our abilities. So we want to try and push our body to make sure that it's strong, make sure that it's healthy, make sure we're feeding it well, so that it can give us the best life that it can. And the good news is that body never loses the ability to adapt. So even if you have been sitting around for a while, or maybe you had an injury that really knocked you down, our body, if we slowly start to increase our activity, increase our stresses on that in a positive way, can respond, and we can again progress towards health. So that's something to keep in mind, and yeah, keep working hard. I appreciate it, and stay tuned for more videos like these as time comes. Thank you.